University of California, Irvine. We thank them for the important role they play in helping sustain the Barclay as Orange County's intimate home for the performing arts. Please take a moment to silence cell phones and to locate the emergency exit nearest your seat. The wearing of face masks is optional. Please enjoy the presentation.
Faculty, Dr. Jill Richardson, the Director of Student Affairs, and Mrs. Hetty Ha, the PharmD Student Affairs Advisor, will be ushering in the students. I now invite the faculty to please stand to usher in the pharmacy students. You may be seated. To the class of 2026, distinguished guests, and family and friends here today, both physically and virtually, what an honor and privilege it is to welcome all of you to the Doctor of Pharmacy White Coat Ceremony at the University of California, Irvine. My name is Megan Nguyen, Founding Associate Dean for Pharmacy Student Affairs, And I've had the incredible opportunity to meet all these students on interview day, as well as get to know them better during orientation these last few days. Students, there are very few times in life that you have the opportunity to be part of something historic, something bigger than yourselves. You choosing to be part of a health profession and an essential worker during one of the most challenging times of our history speaks volumes of who you are. Not only will you be called upon to continue vaccination efforts to curb the COVID-19 pandemic, but also to address the emerging monkeypox infection. You have also chosen to be part of the second founding class in the Doctor of Pharmacy program here at UC Irvine. These choices will forever change you. They will make you stronger, more resilient. They will make you challenge your creativity and give you the courage to create new pharmacist roles and transform the profession to better serve individual patients and advance healthcare equity for all. You will learn to embrace change, to embrace growth, and to embrace the excitement that comes with starting anew, with building and innovating and always looking towards the future. The admissions committee carefully selected each and every one of you, and I thank them for the incredible amount of effort that it took to seat our class. We know you put in countless hours studying to academically prepare you for this next step in your education. The average cumulative GPA of this entering class is at 3.50. That exceeds the national average for admitted pharmacy students every year for over the past decade. This year, the student entering with the highest cumulative GPA is one of our own anteaters. The student comes with an undergraduate cumulative GPA of a 3.97 and a science GPA of 3.98. Many of you have worked in research labs and have published in scientific journals. Several of you have earned a master's degree. 70% of you speak multiple languages, from Spanish, Vietnamese, Khmer, Mandarin, Cantonese, Japanese, Korean, Igbo, Pashto, Arabic, Farsi to French, and many, many more. You also bring a diverse set of talents and life experiences. We celebrate the commitment it took for you to be a national champion in powerlifting, collegiate golf athlete, a D1 esports game captain. And among you is someone who earned their bachelor's degree and survived OCHEM while being a mom. You played in the Cal Poly Pomona Symphonic Wind Ensemble. You bussed tables, bartended, and worked as bank tellers and pharmacy technicians. And some of you have pivoted from another career. Among you is a former elementary school teacher, a sales executive, a lawyer, and an architect. In addition, 22% of you are first-generation students and have chosen to continue with your graduate education here at UC Irvine. You are all meant to be here, and you should be absolutely proud of everything you have accomplished. Family and friends, please join me in giving these students a round of applause for reaching this next milestone. I now have the honor to introduce Dr. Jan Hirsch, Professor and Founding Dean of UC Irvine School of Pharmacy and Pharmaceutical Sciences. Dean Hirsch joined UCI in January 2019 and led the School of Pharmacy and Pharmaceutical Sciences to become the first public school in LA and Orange County region in July 2020. Dean Hirsch is an acclaimed researcher, pharmacist, and organizational leader. Her research interests are focused in the area of pharmacoeconomics and outcomes research. More specifically, the assessment of economic, clinical, and humanistic values of pharmacy services and pharmaceuticals, and integrating patient-reported outcomes into pharmaceutical and medical practices to improve patient management. Dean Hirsch holds a Bachelor of Science degree in pharmacy and a master's and PhD in pharmacy administration from the University of South Carolina. Before joining UCI, she served as professor and chair of the Division of Clinical Pharmacy at UC San Diego Skaggs School of Pharmacy and Pharmaceutical Sciences. Prior to returning to academia, Dean Hirsch spent 14 years in the pharmaceutical and managed care industries. She established and managed outcomes research departments for 2 pharmaceutical companies, Glaxo Group Research and Allergan, and a pharmacy benefit management company, Prescription Solutions. She is also a distinguished fellow of the Get the Medications Right Institute, a distinguished scholar, and a fellow for the National Academies of Practice in Pharmacy, and a recipient of numerous awards. Along with this tremendous community of students, faculty, and staff, Dean Hirsch is positioning our school to be a leader in pharmacy and pharmaceutical sciences innovation, from drug discovery to clinical practice. Please join me in welcoming Dean Hirsch.
Thank you, Dr. Nguyen, for that very kind introduction. So, good afternoon. We are finally here. It is my privilege to welcome the class of 2026 Doctor of Pharmacy students to our white coat ceremony. I would also like to welcome faculty and staff and all of the family and friends that are here with us today or joining us virtually. As we celebrate this incredible milestone today, it's important to reflect on the steps that brought us here today. The innovative vision of Henry and Susan Samueli and Chancellor Howard Gilman served as the catalyst for the founding of the School of Pharmacy and Pharmaceutical Sciences at UC Irvine and the Doctor of Pharmacy program, which was established in 2020. Students, you are joining a school that, well before the PharmD program was added, was already well known for its very strong foundational pharmaceutical sciences program, with our Bachelor's of Science in Pharmaceutical Sciences, Master of Science in Pharmacology, and PhD in Pharmacological Sciences. To our school's faculty and staff, I offer my deepest appreciation for your hard work and dedication in our 16-year journey. We would not be here today without your unwavering commitment to our vision, our school, and our students. And now to our incoming class of student pharmacists. Today, you are making history. You are the second class in the UC Irvine Doctor of Pharmacy program. Today, we celebrate you. You are future leaders and problem solvers who will bring progressive changes to the healthcare system to reduce inequities, expand access, and optimize medication therapy for individual patients and also for patient populations. Now here's a quiz, students. You didn't know it was going to come this early, right? Students, do you remember how I signed your offer letter to join the PharmD program? What was on the bottom? Oh, yes. Fortuna, what? Something like that? Very close, very close. Good, you studied up. Audentes fortuna what? And what does it mean? It means fortune favors the bold. And you are the bold. Remember that. In becoming a pharmacist, you will make a monumental impact on your community, regardless where you end up choosing to practice. Over the next 4 years, you will be trained to become a driving force for advancing health and also wellness of individuals and society by implementing new solutions to optimize medication usage and working as part of a team of professionals, including physicians, nurses, public health professionals, to improve patient outcomes in a cost-effective manner. We are so excited for you as you embark on this next step of your journey, and we are very glad you are here with us. So, congratulations and welcome.
Thank you very much, Dean Hirsch, for your warm welcome. At this time, I would like to now introduce our keynote speaker for this momentous occasion, Dr. Kathy Pham. She traveled here with us to be with us from Washington, D.C. Her presence and remarks will most certainly leave an indelible impression on these students. Dr. Pham is the Director of Policy and Professional Affairs at the American College of Clinical Pharmacy, ACCP, a professional and scientific society that provides leadership, education, advocacy, and resources enabling clinical pharmacists to achieve excellence in practice, research, and education. Dr. Pham came to ACCP from the Pew Charitable Trust and a leading nationally recognized independent nonprofit organization dedicated to improving civic life, strengthening democracy, and making governments more effective and responsive, where she served as senior officer of the Drug Safety Project. The project worked on drug safety aimed to preserve access to the compounded medications for people who require them while helping to protect those patients from the risk of drugs produced under dangerous and illegal conditions. Her previous clinical experience has been in pediatric pharmacy practice, with the majority of that time spent as the newborn intensive care unit clinical specialist and a pharmacy residency director at the Children's National Medical Center in Washington, D.C. She is also a board-certified pediatric pharmacotherapy specialist. Dr. Pham earned her Doctor of Pharmacy degree from Rutgers, the State University of New Jersey. After completing her pharmacy residency at the University of Illinois in Chicago, she practiced as a pediatric clinical pharmacist and held faculty appointments at various schools of pharmacy, including Long Island University, Rutgers, Creighton University, University of Maryland, and Virginia Commonwealth University. Currently, she is a preceptor of the ACCP Professional Leadership Advanced Pharmacy Practice Experience, which provides students pursuing a Doctor of Pharmacy degree with an opportunity to learn about leadership within a professional organization from the perspectives of both elected leaders and staff. Dr. Pham leads ACCP's engagement, collaboration, and communication with medical, pharmacy, other health professional societies, health quality organizations, and payers and purchasers to promote and help achieve medication optimization for individual patients and populations. She participates as the ACCP representative in working groups and task forces of health policy development and research enterprises at the national level that addresses issues of interprofessional practice, research, and education. Dr. Pham's work mirrors that of the Susan and Henry Samueli College of Health Sciences, which is actively striving to do and create the future of healthcare, interprofessional, whole person, precision-driven, and community-serving by a diverse healthcare workforce. Please join me in welcoming Dr. Pham.
Thank you, Dean Nguyen, and thank you, Dean Hirsch, for inviting me today. I'm so honored to be here with you, the distinguished faculty, the class of 2026, and your loved ones in the audience. I remember being in your shoes at the start of my professional curriculum, excited to finally focus on learning the practice of pharmacy. I also recall feeling that I didn't want to let anyone down, especially my parents, who emigrated to this country in 1975. My story might be familiar to very many of you. With the last name of Pham, my Vietnamese heritage is no mystery. I was born in New Jersey, speaking both Vietnamese and English at home. I was raised in both cultures, as my parents tried to preserve Vietnamese tradition and values, sometimes competing with my desire to assimilate as a Vietnamese American. I eventually came to embrace my upbringing and the bridging of these two cultures that would become the foundation of my professional practice and my passion for advocacy. But I didn't know it at the time. I didn't always know I wanted to be a pediatric clinical pharmacist, and I certainly didn't plan for a career in policy and advocacy. As a Rutgers student, I enjoyed community practice and hospital practice. During my experiential rotations, I loved solid organ transplant and pediatrics. So as a PGY1 resident at the University of Illinois at Chicago, I tried them all over again. I experienced these patient care areas again to try to help me decide. But there, one of my residency preceptors at UIC gave me this sage advice. Don't worry about figuring out exactly what you want to do. Focus on figuring out what you don't want to do. This would leave me with a world of possibility, and I would continue to pass this along to all the students and trainees that I would encounter along the way. It would empower me to remain open to opportunities, leading to a unique and fulfilling career. But I didn't know it at the time. You will be motivated to determine your distinct career path, or perhaps some of you came into pharmacy school already having one in mind. Or you might like everything and have a really hard time deciding. Although I used my time in pharmacy school to identify my practice interests and career goals, ultimately there was no roadmap for my current position at ACCP. It comes from one opportunity leading to another, most of these opportunities coming from outside my day job. More than anything, it comes from remaining open to change and trusting your abilities. Our profession will most benefit from your early adoption of a growth mindset. Commit to being a lifelong learner. Embrace the excitement and discomfort of change, that's where we tend to learn and grow the most, and remain flexible and adaptable. So whether your future professional decisions are based on career goals or personal priorities, leaving yourself open to opportunities and being adaptable will be the key to your professional fulfillment. In the coming years of your education and training, you will gain knowledge, analyze data and evidence, apply critical thinking skills, and develop communication skills to a range of audiences, from connecting with your patients and their families to collaborating with other health professionals on the team, or even just convincing an administrator for a needed service or resource. All while practicing and maintaining professionalism, the same professionalism that white coat embodies. These same skills can be applied beyond the practice of pharmacy and are also developing you to be an effective advocate. But you might not know it at the time. I encourage you to celebrate diversity in our profession and in the communities you will serve. Bridging two cultures was really challenging in my youth, but it allowed me to see the world from different perspectives. So whether you come from a different culture or background, or you immerse yourself in a diverse community, you're learning how to relate and communicate with those who may not see the world as you do. And that's a beautiful thing. So it's important to leave space for different views. When I was speaking to patients and their families, or mentoring my diverse group of pharmacy residents, finding the balance or the message that would resonate within that space is the key to advocacy. Growing up Vietnamese American gave me an appreciation and understanding for there being more than one way of doing things and different ways of talking to people, which also helped me become a more effective clinician and advocate. There's also our profession's diversity in career opportunities and practice settings. Like most professions, you may not recognize this when you first enter the workforce. You might think there are only 3 paths: community practice, hospital or clinic practice, and industry. But there will be so much more as you gain experience and stay open to change. These opportunities can come from institutional practice or, if you're bold enough, entrepreneurial endeavors. They may come from within or outside the pharmacy profession. Do not underestimate your knowledge and skills as a pharmacist and how they can be applied outside of traditional pharmacy practice. Don't be afraid to take the non-traditional route, but stay patient until those opportunities come your way. Advocacy starts with you. You don't need to have policy in your title or live in Washington, D.C., or visit the Capitol on the regular. It starts with showing up for your patients and for your team. Your curriculum will incorporate interprofessional education. This will be your first introduction to your roles and responsibilities in a care team. You'll serve as the medication expert for your patients and for your team members in the other health professions. Our U.S. Surgeon General, Vivek Murthy, said this at the 2018 ASHP summer meeting. It was a pharmacist that educated me on the role of the pharmacist in team-based care. He learned what he could expect of the pharmacists on his team by working alongside them. You can represent the profession in practice-based advocacy, advocacy at the local level through actions, accomplishments, and policy change associated with the practice of a profession like the profession of pharmacy. When federal and state policy initiatives are at a standstill, it's the local actions, the practice-based advocacy, that has led to the growth, success, and recognition of clinical pharmacy. For me, advocacy started with the anticoagulant heparin. As an early practitioner, I was typically the only pediatric clinical pharmacist for the hospital, taking turns rounding in the neonatal ICU or NICU, the pediatric ICU, and the general pediatrics floors. But I was always most comfortable in the NICU. And even if you like pediatrics, NICU isn't for everyone. But I enjoyed calculations down to the decimal point and helping to keep our most vulnerable patients safe. In September of 2006, a NICU in Indiana made national news. 6 premature babies were inadvertently administered a 1,000-fold higher heparin dose than what was intended. 3 of those 6 babies died. A year later, a similar incident happened right here on the West Coast in LA and involved a celebrity's twin babies. That brought a lot of media attention to heparin errors. My focus was on preventing the error from happening in my own hospital, but soon heparin got a bad rap. My focus went from keeping my own patients safe to helping keep all NICU patients safe. This thinking is the foundation of practice-based advocacy. My first exercise in advocacy was volunteering just to author a position statement on the safe usage and storage of heparin in neonates on behalf of the Pediatric Pharmacy Association's Advocacy Committee. I would then go on to serve various leadership roles in the organization, representing them in interprofessional advocacy. And through these volunteer efforts, I unintentionally built a resume for a career in policy and advocacy. But I didn't know it at the time. So this brings me to the importance of finding your professional home. As a practitioner, I was active in multiple pharmacy organizations, but eventually one became my true professional home, a place to network, develop professionally, seek leadership opportunities, and contribute back to the profession. So as a student, you'll have the opportunity to explore different pharmacist organizations as a student member. And as your interests and career evolve, you may shift your focus to one particular organization whose mission, goals, and programs resonate with you the most. Be an active member. Find those opportunities to contribute. Form relationships with peers that you may feel like you know better than your own colleagues without ever having worked in the same institution with them. Connect. Connections lead to opportunities. And when you're not sure if you're ready for that next opportunity, go to your mentors or to your peers. Sometimes they'll believe in you more than you believe in yourself. When I first considered the opportunity to lead clinical practice and a residency program that I loved, it was my peers in my professional home that reassured me I was made for this work and ready to take the leap, because I didn't know it at the time. My journey can be summed up in this quote from Mark Nepo. He's a poet, an author, and a cancer survivor. There are no wrong turns, only unexpected paths. To the friends and family in the audience, support their journey, even if you may not understand it. Your support has gotten them this far, and what an accomplishment this is. My parents, who, by the way, are watching this on live stream and have probably told all their friends about this speech, may not have always understood my choices to do a residency, specialize in pediatrics, leave clinical practice for a job that needs an elevator speech more than a business card, and work for a pharmacy organization doing something in DC. But they trusted me to make the right decisions for myself, and trusted me when those decisions didn't turn out the way I wanted to. To the class of 2026, I call on you to be open to all the possibilities. Do not be afraid of change. Lean into the discomfort and find the beauty of growth. Be your authentic self. Be proud of where you've come from and where you're going. And as noted just earlier from that admission letter, the quote from Dean Hirsch, that she includes, "Fortune favors the bold." Over 40 years ago, ACCP was founded by a group of bold pioneers in clinical pharmacy. So be bold in your confidence in your abilities. Be bold in seeking growth and professional fulfillment. That is your fortune. Be bold in creating new opportunities to advance pharmacy practice. Be bold as an advocate for our profession. Thank you and congratulations on the beginning of your professional journey.
Thank you, Dr. Pham, for your inspirational words. Students, you are very, very fortunate to have Dr. Pham here. At this time, I would like to take this opportunity to thank the Anteaters in Pharmacy Alumni Chapter for their generous donation and gifting the students with their first white coats. Inside the collar of each coat is a special quote each donor has selected, so that every time the students put on their white coat, they can be inspired by these words. This coat also serves as a reminder that they have been supported by an alumni network from the very beginning of their journey here at UC Irvine. After you receive your white coat and pin, you will be welcomed by the Class of 2025 Class President, Alexander Chow, and the Admission Student Ambassador, Joanna Park. I would now like to invite Dean Hirsch to coat our Class of 2026, and also Dr. Jonathan Watanabe, Founding Associate Dean of Assessment and Quality, to gift the first set of students with a special pin to wear on their white coats. Rachel Allen, University of California, Irvine. Maha Alsabe, California State University, Fullerton. Orfanel Amaya, University of California, Irvine. Ida Azadeh, University of California, San Diego. Brandon Fisher Brown, Portland State University. Karen Bui, University of California, Irvine. Joseph Chang, University of California, Berkeley. Crystal Chow, California State University, Long Beach. I would now like to invite Dr. Sarah McBain, Founding Associate Dean for Pharmacy Education, to gift the next set of students their pin. Pei-Wen Chen, University of California, San Diego. Jacqueline Dang, University of California, San Diego. Caitlin Dang, University of California, Los Angeles. Aya Nkoji, University of California, Irvine. Baman Farihi, California State University, Long Beach. Connor Griffith, University of California, Irvine. Celine Karabedian, University of California, Irvine. I would now like to invite Dr. Melanie Joe, Founding Associate Dean of Professional Affairs and Chief Pharmacy Officer for UCI Health, to gift the next set of students their pin. Min-Hae Sharon Kim, University of California, Irvine. Jasmine Law, California State University, Long Beach. Lauren Ladoris, University of California, Irvine. Tiffany Lamb, California State University, Long Beach. Leah Lau, California State University, Los Angeles. Victor Lau, University of California, Riverside. Stephen Lau, University of California, Santa Cruz. Louis Lay, California State University, Long Beach. I would now like to invite Dr. Rob Spitali, Founding Associate Dean for Research, to gift the next set of students their pin. William Lay, California State University, Long Beach. Aya Lee, University of California, Irvine. Karen Mai, Loyola Marymount University. Bjorn Manansala, California State University, Long Beach. Martina Bar Mansour, University of California, San Diego. Murray Mina, University of California, Irvine. Nicole Mohajer, University of California, Irvine. Tara Mustafazadeh Fard, New Mexico State University. Rana Nabulsi, University of California, Irvine. Cameron Nguyen, University of California, San Diego. Michelle Nguyen, Santa Clara University. Min Nguyen, California State Polytechnic University, Pomona. Tien Han Nguyen, University of California, Irvine. Timothy Nguyen, University of California, Irvine. Vincent Nguyen, University of California, Irvine. Meredy Okenwa, University of California, Irvine. I would now like to invite Dr. Alex Chan, Founding Chair for the Department of Clinical Pharmacy Practice, to gift the next students their pin. Perena Reddy, California State University, Long Beach. Dennis Joshua Sedora, University of California, Irvine. Sarah Sarpes, California State University, Long Beach. Andrew Shea, University of California, San Diego. Kane Stallions, University of California, Irvine. I would now like to invite Dr. Andre Luptak, Chair for the Department of Pharmaceutical Sciences, to gift the final set of students their pin. Tracy Tran, University of California, San Diego. Wendy Trin, University of California, Irvine. Zachary Wallach, University of California, San Diego.
Great job, everyone. I was just waiting for our last student to get back to the seat. I was like, congratulations. You have your white coats. I have the pleasure of being able to look at you. I see you. You look all very professional and spectacular, I have to say. This is as good as you're going to look for a while, probably. This is not classroom look. Just letting you know, friends and family. So now it is with great pleasure that I introduce our last speaker, Dr. Dennis Kitayama, a distinguished UCI alumni who would like to welcome you to the profession of pharmacy. Dr. Kitayama recently retired after 42 years as a pharmacist, preceptor, teacher, and mentor. In the early part of his career, he was clinical pharmacy coordinator and director of pharmacy at Friendly Hills Regional Medical Center in La Habra, California. For 15 years, he served as a preceptor for pharmacy students on his inpatient medicine rotation and established the postgraduate Year 2 ambulatory care pharmacy residency program. Dr. Kitayama was project manager, inpatient content at Kaiser Permanente during the implementation and maintenance phases of the EPIC electronic health record that allows all providers access to address and track patient status and progress. He was also residency program coordinator and preceptor for the postgraduate Year 2 pharmacy informatics residency program, which was a brand new area for the application of pharmacy expertise to solve medication management problems. Dr. Kitayama is a guest lecturer in pharmacy informatics and holds adjunct faculty positions at multiple schools of pharmacy. Over the last 22 years, he has mentored dozens of students as part of UC Irvine's mentor programs, including our own alumni mentorship program. Dr. Kitayama received his Bachelor of Science in Biological Sciences from the University of California, Irvine, his PharmD from the University of the Pacific, and his postgraduate Year 1 residency in clinical and hospital pharmacy from UC San Francisco. He has been the recipient of several awards from UC San Francisco, including Long Award for Excellence in Teaching, Preceptor of the Year, and also the Alumni Achievement Award for Mentoring. This past year, Dr. Kitayama was the first distinguished alumnus awarded by our school at UC Irvine School of Pharmacy and Pharmaceutical Sciences at our 2022 Lauds and Laurels event, which recognizes UCI alumni whose personal or professional achievements bring honor and distinction to UC Irvine. Dr. Kitayama certainly meets these criteria. So please join me in welcoming Dr. Kitayama.
Thank you, Dean Hirsch, for the introduction and for the opportunity to speak today. I entered UCI as a freshman in the fall quarter of 1972 with aspirations of becoming a pharmacist. I was lost in many ways, but eager and excited to prepare myself for pharmacy school and for the adventures that lied ahead. One thing was for certain back then. I never dreamt that I would be addressing the incoming class of UCI's pharmacy school exactly 50 years later. As a fellow anteater, I would like to extend my heartfelt welcome and congratulations to the UCI PharmD class of 2026, the school's second PharmD class. You are entering an exciting profession of pharmacy with limitless possibilities. You all worked incredibly hard to get here, and you should be very proud. You also had support from your families, instructors, mentors, and peers along the way. A twist of the saying, "It takes a village to raise a child," is it takes many villages to produce a pharmacist. Now, I've witnessed many changes in the pharmacy profession over 4 decades. As a mentor and preceptor, I'm accustomed to giving advice to students. So I'd like to take this opportunity to pass on some advice that may help you through the next few years. I'll be discussing 4 terms that you'll likely hear a lot or experience in pharmacy school and beyond. You will be familiar with each of these terms, but they'll be emphasized in a higher degree from this point forward. I'll start with multitasking. Besides studying for your exams, you'll be constantly involved in many activities outside your classroom that will help you prepare for the pharmacy profession. For instance, you may be leading a committee meeting at a campus event. You may be interning at a job or finishing up a rotation, all while trying to find time to study for your exams. Like all previous transitions that you've made through school, you will adjust to the higher degree of multitasking as this becomes your new normal. But also take note that these activities will prepare you for, say, postgraduate training, such as a residency, or for any pharmacist position. And now that you're starting pharmacy school, what field of pharmacy will you pursue? Well, don't worry about that yet, especially today, as you will have plenty of time and have many experiences that will help you make that decision. But over the years, many students, residents, and pharmacists have told me there was one professor or one class, one preceptor or one rotation, or even one conversation at a pharmacy networking event that helped influence the field of pharmacy they would pursue. Building your pharmacy network, which is my second topic, will improve your chance of finding that pivotal moment that can change the trajectory of your career path. Now, I'm not suggesting that everyone finds their field of pharmacy in this manner. On a personal note, I entered pharmacy school with the hope of pursuing inpatient or hospital pharmacy, and that turned out to be my field for 20 years. Receiving firsthand knowledge of the vast areas of pharmacy from the pharmacists themselves will only benefit you, and you will be amazed by all the unique and important areas where pharmacists are contributing to patient care. Now, there are online tools that can help you build your professional network, but the object is not to simply connect with as many people as possible on LinkedIn. However, these online tools can be used to keep in contact with someone you met at a convention, or review the background of an interviewer before you interview with that person, as examples. My third topic is leadership. This is a word you'll hear a lot in pharmacy school. You're fortunate to have great leaders in the pharmacy profession here at UCI, both here on campus at the school and at the medical center. When you apply to a postgraduate position or a pharmacist position, having leadership experience will certainly strengthen your CV or application. And though I sense that a future president of CSHP or APHA is amongst the class of 2026, you do not have to hold a title or an office to be a leader. Having leadership qualities will be important for you as pharmacists. For those of you who will say will have a frontline patient care position as your first job as a pharmacist, there will come that time when you will be the only pharmacist on duty. And that will probably come sooner rather than later. When that occurs, the pharmacy technicians and interns will be looking at you as their leaders. Your leadership qualities will also be noticed by other healthcare professionals and by the patient as you provide decisions that affect the care of the patient. The last topic I'd like to discuss is stepping outside of your comfort zone. You will certainly be challenged outside of your comfort zone in pharmacy school, but that's part of the educational process. I'm referring more to directional changes that you make that will help you grow professionally. I'll provide you with another personal example. I was in hospital pharmacy for many years and felt very comfortable in that environment. Halfway through my career, I had the opportunity to transition to pharmacy informatics, which in simple terms is the application of technology to pharmacy practice. The field of pharmacy informatics did not exist when I graduated from pharmacy school, but the implementation of the electronic health record required pharmacist expertise to configure the software for the users of the system. And in my case, the users were the pharmacists, physicians, and nurses working in the hospitals. I had no formal training in informatics, and I had doubts whether my skill set was sufficient to make such a drastic career change. But I got trained in the software, and I led a team that helped Kaiser Permanente transition from physicians handwriting medication orders onto a paper chart to typing and clicking orders into an electronic medical record. And this is a term called computerized provider order entry, or CPOE, and this is now the standard of practice. Now I can look back now and say that all of my previous pharmacy experiences helped me with my pharmacy informatics position. But this is not unique to me. You will find that all of your pharmacy experiences build on one another. You will be trained in traditional and new areas of pharmacy, but there will be areas of pharmacy in the future developed that do not exist today, similar to how pharmacy informatics was created after I graduated. Stepping out of your comfort zone may lead you to transitioning to a new field of pharmacy or even creating a new field of pharmacy in the future. Now it's time to start your careers in the pharmacy profession. Because I recently retired, I feel that I am passing the baton to all of you. Take it from me. No matter how many years you spend practicing pharmacy, you'll always have vivid memories of your pharmacy school experiences and your classmates. This is an exciting and extremely important time for you. And I know that the faculty is equally enthusiastic about maximizing your development and making the most of your pharmacy school experience. If you participated in the mentor program, there are several mentors eager to share their experiences with you and guide you, including me. Best of luck to all of you, and have fun on your journey. Thank you.
Thank you, Dr. Kitayama, for those inspiring but also extremely practical words of advice. I hope you all remember those and let those guide you as you go through these next 4 years. So, members of the PharmD class of 2026 and members of the pharmacy profession who are in our audience today, virtually or in person, please stand as we recite the oath of a pharmacist. You can use the back cover of your program as a guide. I will lead you, so please repeat after me. I promise to devote myself to a lifetime of service to others through the profession of pharmacy and fulfilling this vow.
I promise to devote myself to a lifetime of service to others through the profession of pharmacy and fulfilling this vow.
I will consider the welfare of humanity and relief of suffering my primary concerns. I will promote inclusion, embrace diversity, and advocate for justice to advance health equity. I will apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for all patients.
I will apply
I will respect and protect all personal and health information entrusted to me. I will accept the responsibility to improve my professional knowledge, expertise, and self-awareness. I will hold myself and my colleagues to the highest principles of our profession's moral, ethical, and legal conduct. I will embrace and advocate changes that improve patient care. I will utilize my knowledge, skills, experiences, and values to prepare the next generation of pharmacists. I take these vows voluntarily with the full realization of the responsibility with which I am entrusted by the public. You may now be seated. I know I speak for all of our UCI faculty and staff in extending you, the class of 2026, the very best wishes as you embark on your career as a student pharmacist here at UCI. I'd like to point out one of the best things about today is that you are embarking on the unknown. That's scary. The unknown is always scary, just a bit, right? It is scary, but it's also exciting. It's amazingly exciting. I would like for you to remember the feeling you're having right now and the feeling you had up here putting on the white coat. Remember it so that you will be able to recall it and re-experience it in the future. In 4 years, you will graduate from this program a very different person than the person you are sitting here today. In our program, you will be taught by scientists who are pioneers in the discovery, development, and delivery of new drugs, devices, and diagnostics. You will be trained by clinical pharmacists to be the next generation of pharmacists who will have the power to make life-changing impacts on the lives and health outcomes of patients and their families. As you undergo this transformation, you will face many challenges and tests. Make a choice to be brave, yet compassionate. And always remember, fortune favors the bold. To the many families and friends that are here today, either here or joining us live stream, your continued support and encouragement will be critical to these students as they embark on this next step in their journey. So students, before we conclude, I would like you all to stand, turn around, wave, say thank you to your family and friends for all the support they have provided so far. That is well-deserved applause, family and friends. Okay, and finally, and you may be seated. No. As we come to the end, you are our new UCI anteaters. I did not count the number of you that were already here, and so you are anteaters, but we have new anteaters. So we cannot leave unless we teach you the zot, zot, zot. We cannot leave anything at UCI without doing this. Okay, so if you're not an anteater, all right, here is how you do this. You raise your two hands. Okay, the two middle fingers go down, these fingers go up. Okay, and then you pull back your thumb, then your two fingers in the middle go down. That's the snout. We're making an anteater. If you imagine very clearly, it's an anteater. Okay, and then what anteaters do is they go zot, zot, zot. There's 3 zots. All right, so now when I count to 3, we're going to go zot, zot, zot. And the key is we do it really loudly, because anteaters are loud. Okay, ready? 1, 2, 3, zot, zot, zot. Woohoo! There you go. You can ask all my colleagues back here that are laughing at me. This is my favorite part. So that brings us to the conclusion of today's white coat ceremony. On behalf of the University of California, Irvine and the UC School of Pharmacy and Pharmaceutical Sciences, I congratulate our PharmD class of 2026 one more time. At this time, I now ask everyone to stand as we begin the recessional of the platform party and students. I'd ask each of you who are guests to please remain at your seat. The platform party will proceed first, and then the class will be led by Dr. Jill Richardson and Mrs. Hetty Ha. After the students have departed, we ask that our guests exit and join us at the reception, which is outside. The students will arrive at the reception after we've had a few photos taken in here. So with that, congratulations, and we will meet you all outside.